Welcome back to Connecticut's Morning Buzz. We are talking about fighting for a future where colorectal cancer is no longer a threat. Looking ahead, March is Colorectal Cancer Awareness Month, and we are joined live by Dr. Hussein Wazaz from Mid-State Gastroenterology Specialist. He's going to tell us more about what we need to know here. Thank you so much for joining us, Doctor.
Okay, thank you, Natasha. So colon cancer is a very common cancer, and it affects a lot of people still to this day. It affects 1 in 20 people. It's more common in women, and it's still diagnosed 150,000 cases a year. The message I'm trying to tell the audience right now, without scaring them, we have tests that actually detect the cancer, and it can prevent the cancer. So we're going to talk about colonoscopy. I know people, when they come to me, it's like, do you want me to have a colonoscopy? I said, yes, I'm a GI doctor, you know.
But for most people, colonoscopies can be a little scary. It's not their favorite thing to do, but they're important.
I know, but there's a lot of misconception, and we're trying to talk about it right now. Number one is not painful, because you're going to be sedated, and now we get better sedation where the patient really doesn't feel anything, and sometimes they claim they have the best sleep of their life. So that's an added benefit. The PrEP is an issue for some people, but you can actually have a clear liquid diet the day before. And we have multiple PrEP options, including pills for people who cannot take the liquid, and the amount of liquid gets smaller, so make it more patient-friendly. And now at Mid-State GI, we have a very, very streamlined process where people contact us directly or through the website. We can have it done in a timely manner, and we have a central location for endoscopy center where patient actually can come and leave within 2 hours.
Yeah, that's
so
quick.
It is very, very convenient and painless procedures.
Well, and I know too, with cancers, especially colon cancer, early prevention is key. Could you walk us through some of the guidelines here? What age should people start getting screened? How often? I
mean, the guideline has changed. It used to be the big 5-0. Now we lower the age to 45 because we found an alarming trend as more and more people get diagnosed at an early age. Yeah. And we diagnose at 45 if you have a high risk of family history of colon cancer, certain ethnic background. We may even start at 40 and even in their 30. And alarming is it's happening at people in their 20 and sometimes even in adolescence, which is make us also have a higher threshold for scoping these people. Right,
that is alarming. And you actually have a personal experience with a patient who is in her 20s, who ended up being diagnosed with colon cancer. Can you tell us about her experience?
Actually, I have a couple of patients, a couple of them which came with, one patient was have a hard time going to the bathroom, the other patient was rectal bleeding. She seen other provider and was told hemorrhoid, IBS, but we decided to scope them because of the severity of their symptoms. Unfortunately, they have both of them in the left side of the colon, which we call that rectosigmoid. They end up having curative surgical resection, and both of them, I'm happy to tell the audience, they're living happily with no problem. So it can be cured.
Great news. And of course, keeping up with those screenings is really important. Now, you have multiple locations around the state for Mid-State Gastroenterology.
Yes, we have location from Woodbridge. We are in Hamden, North Haven. We have our main hub is at Mid-State in Meriden. We have endoscopy center in Wallingford, but we are in Watertown, we are in Bristol, we are in Southington, and also we have an office in Farmington. So we can get the patient in a timely manner. We are physician-owned and smaller, which gives us an advantage because we work faster. We have very good, friendly staff, and our providers are focusing, purely on patient care.
Yeah, that is really wonderful. Very quickly before we go, I want you to just tell our viewers, maybe they are under that 45-year age, but anything they should look out for that is abnormal, that should bring them into maybe one of your centers?
I mean, it's a nice morning, so I don't want to scare them. But if you have any GI symptoms, yes, if you have a hard time going to the bathroom, if your bowel habit change, if you have a weight loss, if you have a blood in the stool, or something doesn't feel right, if you have a severe stomach pain, you have to really check with your primary care providers and get checked. And one final thing, Natasha, before I go, I mean, people say about they want to have a stool-based testing, which is there's a couple of them in the market. I want to warn the audience also of the limitation of the test. And actually, these tests doesn't detect and doesn't prevent colon cancer. It may be able to detect it, but it doesn't prevent it because colon cancer starts in a polyp. And when we do the colonoscopy, we remove the polyp, which that would prevent colon cancer.
Okay, all good things to know. Dr. Hussein Wazaz, thank you so much for the great info as always.
All right, thank you.
And of course, if you would like to learn more, you could go to midstategastroct.com or our website, WTNH.com as well. And don't go anywhere.